Good afternoon, everyone. My name is Morgan Gargiulo from the New England QIN-QIO, and I will be your moderator for today's webinar, QPP Portal Preparing for 2018 Data Submission. Before we get started, I wanted to go over a few housekeeping items. This call is being recorded for training purposes, and I will provide you with details on accessing the recording at the end of the webinar. The phone lines are on mute for the duration of the presentation. If you haven't yet downloaded the slides, I'm going to go ahead and put a link to that in the chat box so you can find them. We will take questions throughout the presentation, and we'll allow you to ask questions at the end over the phone if you like. If you have a question, please put it in the chat at the bottom right corner of your screen, and make sure to send it to all participants so that we can keep up with the incoming questions. So, Leela, I'll pass it over to you to get started.
Great. Thank you, Morgan. Hello, everyone. My name is Leela Volinsky. I am a Senior Program Administrator for the New England Quality Improvement Organization. Today, we are going to be talking about the QPP Portal and preparing for your data submission for 2018 program data. Just a quick overview of what I'll be covering. So we'll talk a little about the HARP account. CMS has transitioned away from the EIDM or Enterprise Identity Management to this HARP, which is HCQIS, Access, Roles, and Profiles account. We'll talk about why you need one, how to register. We'll then get into the specifics of the QPP portal and data submission, how you can identify your eligibility in the different program performance categories. There will be lots of time for questions and discussion, and I'll share some resources with you at the very end. Couple key dates I just want you to be aware of. So the QPP data submission period opened if you're using the QPP portal or a registry on January 2nd, so last week, and it will run through April 2nd. CMS sometimes provides extensions, but at the moment the submission period will close on April 2nd. If you are submitting data for 2018 performance using the CMS web interface, if you're part of an accountable care organization that's participating as an alternative payment model, or in a large practice that registered to use the web interface last year, you have between January 22nd and March 22nd, so slightly different dates, to submit your data to CMS. Just keep those in mind because you don't want to get to the end of the reporting period and have not submit your data. So, the HARP account, as I mentioned, is the HCQIS Access, Roles, and Profiles account. Many of you who had an EIDM account last year should hopefully, the way the system is designed, have that account still be active when you go to log into the CMS QPP portal. We have heard there have been a couple of hiccups along the way. Obviously, when a system transitions, there's sometimes some issues, but we are very hopeful that when you log in to the QPP portal using your previously created and active EIDM account, that it will still work as it did before. If you have any issues, please let us know. It's very critical that you have an account that works so that you can get into the system and upload your data. If you didn't have an EIDM account and you need to submit data, whether you're the office manager, program administrator, whatever the case might be, you would need to get a HARP account. So this is a secure identity management portal account that would allow you access, as I mentioned. Previously, it was through the EIDM account, and as I also said, you should have access if you already had an EIDM account. These are kind of redundant slides, but just want to make sure if you need a new EIDM account, you go through the HARP process, which we'll talk about. If you had a previously existing active EIDM account, you would go back through the portal and use your same login, password, and all of that. All right, so how do you register for a HARP account? You would go right to the CMS QPP Portal website, which is https://qpp.cms.gov, and up in the far right-hand corner, you would see Sign In. When you click Sign In, it would bring you to the screenshot that's on your screen right now, and when you look at it, you can see there's a little box highlighted. I apologize, it's very small, and it says Register. When you click Register, that would bring you to the next page. And this would tell you a little more information about why you need to register and how you get access to the QPP portal. And then you click the button at the bottom, that orange button that gives you registration information. And then you would move into the actual HARP account creation. So on the first page, you will do typical account creation. You'll enter your first name, last name, all of the pertinent details, birth date, address, social security number. Important information, this is your home address. This isn't your work address, this is your home address. We'll talk in a few minutes about the identity verification process, but they are looking at your home address. Next, you would choose your password and challenge question. Again, make sure you choose something that you'll remember. It's very important that you have something that sticks in your brain and that you're not scrambling to find when you actually go to log in. Once you have all of that information entered, you would do what they call remote proofing. And through remote proofing, they're just making sure that you are who you are. So if you've ever looked at a credit report, CMS uses Experian here. So you'll see very similar questions where in the last 5 years, did you ever live at one of these addresses? They give you a couple address options. You would pick the one that most looks like something you've lived at. So typically like Main Street or whatever the case might be. They'll also give you some other questions about other identity proofing information. If you enter something that's incorrect, you will get this error message. Again, it's really important that you make sure that your information is accurate. If you move through this, then you would have to go to a manual process because you didn't accurately say whatever the answers to the questions were. So go back, check your answers, make sure that they're correct. If they are correct and you still get this error, you do need to proceed, and then you'll have to go through the manual process. If you go through and everything is correct, you'll get a confirmation screen, and you'll get your login information. You are not quite done yet, though. Next, you have to do the two-factor authentication. This just means that it's confirming you are, in fact, who you say you are, using a code that sets device of your choosing. Oftentimes, like a cell phone or an email address with a specific code that you would then enter to make sure you are who you say you are. As you can see here, you go through the process. It sends you the code. You enter the code into the spaces provided. Now, your account is completed, but again, you're not quite done yet. So once you have your account, everything looks good, you would go in and log in, and this is where you would actually have to assign yourself to an organization or practice. So in the Manage Access screen, you'll see there's a couple different options. You would click Manage Access, and this person was already with several practices, but you would see if you were linked to a practice previously what you had access to. If you're not actually linked to a practice yet, you would need to do the Connect to an Organization process. So under this process, you would select an organization, a practice highlighted, but you could be an EPM entity or working with a registry or a virtual group. You would select whatever is most appropriate for you. And then from there, you need to actually identify that practice or organization. So here you would type in either the TIN, the tax ID number, or the business legal name here. You would search for it and then identify the appropriate organization. Once you select the appropriate organization, you have to actually select a role. So what is your first role going to be? If you are the very first individual to get an account for that practice or organization, you are automatically the security official, because there has to be a security official in order to approve any subsequent requests, and that's just the first role that CMS gives to an individual. So, as you'll see here, this person had options, but if, let's say, you're not the first person, you would be able to select either staff user or security official. You can have multiple staff users or security officials, but you do have to have at least one security official first before you can have any other roles on your account. Once you select whatever your role is going to be, especially if you're the first security official, you do have to actually confirm that you know the organization that you've selected. Just having the TIN or business legal name does not mean that you know the practice. So you have to enter the TIN again. You have to enter an NPI for a connected clinician within that organization, and you also have to enter the TTAN for that practice or organization. Then you'll move on, and you'll see an approval of your request is pending. There we go. I'm not going to go into all of the other screens. If you are a subsequent security official or staff user, your request would go right to the first security official, and they would have to either approve or deny your request. And the next time you log in, you would see whether your request was approved or denied. And from there, you'd need to go through the rest of the process. You will have access to all these slides, and here's a quick breakdown. I'm not going to read through all of these, but if you have questions about what role you should be selecting, there's information about the staff user role and the security official role based on what you would need to be doing for the organization and where you would go. All right, so that was a quick HARP account. I'm not going to get into tons of detail about that, but just want to make sure you all knew what you needed to do. If you have questions, definitely reach out and let us know. We don't have a lot of access to the HARP side of things. You would need to go through the CMS QPP help desk if you have specific errors you're coming upon, or if you can't access because your password's expired or whatever the case is. Unfortunately, we can't help you update those, but we are happy to help you get in touch with whomever you need to be in touch with. So next is the CMS QPP Portal data submission overview. These are all screenshots. I just want to let you know we're not doing a live demonstration, unfortunately, so I apologize. Some of them are a little blurry, and I don't have every single aspect of every screen showing, but it will give you an idea of once you log in where you need to submit data. Overall, the portal is pretty similar to the way it was last year with some slight changes, so just be aware of those couple changes. So, first you come to what we're going to call the landing page. This would be the first screen you see when you log in. And as you can see, at the very top, there's a timeline. This shows you the start of the submission period. These dates actually are not correct, and I apologize for that. Next, you have the data submission window is now open. So you can just click Start Reporting if you're ready to get going and you know everything you need to submit. If you want to access anything, that Manage Access screen that we were just on, or if you want to go to the Physician Compare Preview, or if you want to look at your performance feedback from last year's data submission, or if you want to look at your eligibility and reporting, you can click any of these links on the side, the left side of the screen. And then finally, if you want to look at the final performance feedback, you can click this bottom link. So lots of different ways to navigate around this landing page within the portal. If you're curious about your eligibility and reporting, so this would be looking at any practices, virtual groups, registries, or APMs that you are affiliated with, you can go into this eligibility and reporting screen, and it would show you under the various tabs what each of your linked organizations has applicable to it. So I've clicked practices here. You can see I've blocked out the name, but this is a virtual group. It tells you a little more information about that group. If you're ready to report, you can click Report as a Group or Report as Individuals. If you click down a little on the screen, I apologize, I have to scroll, you'll see that this group exceeds the low volume threshold. Their total Medicare patients for the practice shows you it's a little over 515,000. Their total allowed charges for the practice are, it's a little blurry, a little over 859,000. And they do have several special status determinations. So they are an ambulatory surgery center, they're health professional shortage area, and they're rural. So remember those different changes for reporting. Again, you can choose to report as a group, report as individuals. If you're looking at multiple clinicians and you want to know specifically how each of those clinicians can report, you also have the option to click View Clinician Eligibility, and that would take you to a list of all of the affiliated NPIs within the practice. That would look the same for virtual groups, so I'm not actually going to click on that tab. For registries, you would see any registries that you are affiliated with. So this organization has two, the American Academy of Ophthalmology IRIS Registry. So you could go right to Start Reporting, or the AAD's Data Derm, again, Start Reporting. So lots of options to navigate around. Oops, my screen didn't advance. Oh, there we go. If you're looking for specific details, again, if you want to know whether the practice is included or exempt, so if you click on a different organization, this one is MIPS exempt, it's a small practice, you can collapse any of the details. You can also see the various clinicians. So lots of different views of the information. So now we're actually going to talk about reporting. So if you click on the eligibility and reporting, and you click on the practice details, and then you click on group reporting overview, you would come to this screen. And again, I have the practice name and information blocked out, but you would see your specific practice, let's say it's Main Street Physicians, whatever the TIN is, and the various address of that. It would give you an option to start reporting right there. So if you want to upload a file because you have QRDA3 files from your EHR vendor, or a MIPS file, or a JSON file from a registry, you can go right in and upload that file and be ready to go for the rest of your reporting. If you scroll down on that page, you also can see exactly how you're performing within your various performance categories. So if you look at this one, there's a nice little detail here. Quality counts for 75% of your score. So this is for a practice that had their promoting interoperability related. As you can see, that 25% went to quality to make it 75. If you scroll down a little further, again, here's promoting interoperability. PI counts for 0%. You can again see that it is 0. You would want to make sure that you don't actually submit anything for this category because it would wipe out any exclusion you already have. Improvement activities, there's a nice bar where you can see what your performance is thus far, if you've entered any data. Remember, CMS gives you the option where you can kind of continually add data throughout this reporting period. You don't have to do a one-time upload everything. You can slowly add different performance categories, different measures, whatever works best for you. If you upload a report and you find out that maybe there was an error or an issue, you can always delete that report and add a new one. Lots of flexibility throughout the next just shy of 8 weeks until the submission period closes. You will also see at the bottom cost. So obviously information comes right from the claims information, and it is not available until later on in the data evaluation period. And then if you are eligible for any of those bonus points, CMS talks about the complex patient bonus or any quality improvement bonuses that you might be eligible for. At the bottom of the screen, I don't have a screenshot of it. There is a nice bar that will show you all of the points for each of the performance categories and what your preliminary score is. So, to upload a report, you would go into whatever performance category or right off of that main Start Reporting screen and click Upload File. You would come to this first center image that I have where it says Upload Data. You would click that, or if you like to do the drag and drop, you can just pull your file over and drop it in the box, and it would upload to the website. What you do really need to make sure is that you have the correct file type, so XML, JSON, QRDA3, make sure that you have the correct file type. Once you've selected your file, you can see it at the bottom there, so it's one all category _ ehr.json. You can delete that if there's an issue, and then you would click Upload. Assuming your upload is accepted and there's no issues, you would see the screenshot on the side where that file is uploaded and you get a nice little green check mark, Upload Successful. If you have any errors, you would want to make sure that you go back and upload that file again. If it continues to error, you would probably need to work with your vendor or whoever created that data file for you to make sure that it is the correct file type, or if there's any sort of corruption within that file that it gets corrected. All right, so we're going to dig into quality now. So if we go back to that quality reporting page, you would see the overview, kind of how did you perform. This organization reported EHR data. They maxed out their points. It says 100 out of 100. So this is 50% of their score. So moving right along, they uploaded data similar to how it was last year. You can see right on this little graph, CMS is showing you that you have achieved full points for the category. It shows you the measures that counted towards the quality performance category. You had 6 measures, a subtotal of 58.8 points, which would get you over that 100% of the 50 points. And then any measures that earned bonus points, there were 4 measures, and there was a total of 5. 4 measures were submitted and 5 total bonus points. If you have questions about how each measure performed, you can click on the measure name. So this is the diabetes hemoglobin A1C for control measure. Performance rate was 33.3. On the benchmark tool, based on EHR reporting, you would get 8.1 points. And you can see the whole breakdown. It's really nice graphical representation. Shows you where that 33.3 falls on the graph. and you get some bonus points. You had a numerator of 33, denominator of 99, data completeness of 99%, eligible population was 100, points from benchmark score was 7.11, and then you got 1 point for the end-to-end reporting out of the EHR. So it shows you how the whole score breakdown gets calculated. If you have any questions about that measure and the specifications, you can click the hyperlink at the bottom to go right into that measure's specific specification sheet and walk through the algorithm there. Once you've uploaded all of your data and have it ready to go, you can see also a preliminary quality performance category score. So the total points coming from the measure, your total bonus points, over your possible points, times the category weight, and that gets you to the percent of points earned towards your MIPS final score. From here, you can go back to that overview screen, or you can bounce right along into the Promoting Interoperability category if you want. You can also navigate on that same side left-hand bar. You can jump right down to Promoting Interoperability. Really lots of flexibility, again, based on how you like to navigate the best. So, now we'll jump right into Promoting Interoperability. As you recall, unlike quality, which can only have a file uploaded, you can't actually manually attach any data within the portal. Promoting Interoperability offers you two different methods for submitting data. You can either upload a report or you can manually attach data. You'll see here that this organization used, again, the EHR report. There is also the status bar on the bottom for manually entered measures. As we look at the Promoting Interoperability screen, it's a little different than quality because, again, there's a few more aspects that you need to be aware of. So this organization, again, submitted an EHR file. We're going to pretend for a moment that this file doesn't exist and that you are manually entering data, because when you upload a file, you don't get to change any of the, either the EHR versions or your time frame. It's already set. So if you manually enter data, though, in the first step, you would want to select your performance period, make sure that it is at least 90 days, any continuous 90-day period in 2018, and then you would also want to make sure that you're selecting the appropriate measure set. And that measure set is dependent upon the EHR certification year that you are using. So if you're using a 2014 certified EHR, you would be selecting the 2018 Promoting Interoperability Transition Measures. If you're using a 2015 certified system, you would be using the Promoting Interoperability Measures or the 2018 Transition Measures. Or if you're using some combination of 2014, 2015, and you decide you want to use a combination of the measures, you can select that as well. Once you've selected the measures, CMS does still have its same 3 attestation statements that you do have to complete. Obviously, the ONC ACB surveillance is still an optional measure, but you'd have to attest to both the prevention of information blocking and the ONC direct review attestation. They have to be yes in order to move on with the category. Because of the way that the Promoting Interoperability category is scored, you would need to select the required measures in the base performance in order to move on to the next section. So I just have one shown here. There is both the 2018 transition on the right-hand side and the standard Promoting Interoperability measure on the left-hand side. This was a combination, as you can see, combination of both sets of measures, so you can select which one is most appropriate for your practice. And just as you did before, if you did any sort of manual attestation, you would be entering in the numerator and denominator applicable to this measure. As you can see, I only show one measure for the base required, but it would be the same for the others. If there's a proposed measure exclusion and your practice falls within the appropriate exclusion criteria, you would go ahead and just click that exclusion box at the bottom there, and that would gray out the entire measure. You wouldn't have to report on it, but you would get credit, you're not actually getting points credit, but you would get credit for the category performance rather than losing points because you didn't meet the requirement. Moving along, you will see the optional performance measures. These, again, are additional measures that you can earn bonus points for. So if you have any data to support them, I would say highly recommend reporting data. As you can see on the top right corner of the screenshot, completed measures is 8 and total score is 90 out of 100. So this practice completed 8 measures thus far and has earned a score of 90. You'll then come to the bonus measures at the bottom. I'm only showing the 2015 CERT bonus, which is that 10 points, but you will say yes or no. You'd also have the opportunity to attest to the clinical and data reporting. So if you're using the immunization registry or the clinical data registries, that you've utilized one of those. Similar to quality, you can go back to the overview or you can move on to improvement activities. You can also select improvement activities from the 5 left screens or go back to whatever other screen you might have interest in going to. Improvement activity reporting, very similar to the previous. You'll see where your performance is and how you have already met the measure. So this practice has earned 10 points through its EHR reporting, and then obviously manual reporting, they have not earned any points yet. Under the improvement activity category, very similar to promoting interoperability, I apologize it got cut off, but at the very top of the screen you can see that performance category where you select the performance period, and you would want to make sure, again, you select at least 90 days. That's the requirement for the performance category. Next, you can go through the list of 112. If you have any filters you want to select, let's say you want to look at all beneficiary engagement, you can click that category or care coordination. And then if you have any specific searches you want to conduct, maybe around medication reconciliation, excuse me, or anything else, you can enter that data right there. When you go to actually attest to an improvement activity, you'll see all of the information about that improvement activity and whether or not it is applicable for that CERT bonus for the Promoting Interoperability category that we just talked about. If you would like to select that specific improvement activity, you would simply click on the check mark and you would get the score for whatever that activity earns. So this one is a medium-weighted improvement activity, you would get 10 points. You can see they have one checked off for MIPS-eligible clinician leadership in clinical trials. That earned them 1 activity and 10 points. I apologize because I didn't show it in previous slides, but if you earn the full category score, so for improvement activities it's 40 out of 40, then you'll see a little box pop up at the bottom. You can see this little tiny trophy, and it says max score for this category has been achieved. So that just means you've gotten the maximum possible score for the category, and you don't need to report on any additional activities or measures unless you want to. And that is the case for all of the improvement activities, promoting interoperability and quality. If you max it out, you'll get that little pop-up. If you have any bonus points that you are awarded, you would see this screen that shows you that this practice earned quite a few for the complex patient bonus. It actually got the max points, just 5.14 out of 5. So if you have any of those, you would show them there. If you're using a registry and you submit your report, you would see for any TIN or NPI linked to that report, you'll see the actual breakdown of the performance category score. So there's the quality measures, which shows they earned the full 50 points, promoting interoperability at 25, and so on and so forth. I want to leave ample time for questioning. If you want me to go back to any slides and review the content there, please let me know. I know it's a lot of information. If you haven't already gone into the portal, I highly recommend you make sure that your access works. If you are going off of a previously created EIDM account, please try to access your account now, because if you have any issues, it is really important that you get those issues resolved early, not wait until March 31st to try to work with CMS to get that corrected. If you're new to getting the HARP account, again, it's a new process, so it's better to get that taken care of early than wait until the end of the reporting period and hope that you can get it taken care of in a quick, timely manner. If you have questions that you don't want to ask in the chat or over the phone, feel free to email me. If you'd like to ask a question over the phone, it's #6. Now, I will hang on the line and answer any questions, jump back to slides, whatever you need help with.
Layla. How are you?
Good. How are you?
This is a question from Bold Channel. I'm just wondering, for the bonus points, like the small practice, when do those show? Do you have to fill in all the other categories, like the quality and everything, in order for those to?
They should come once you identify your practice, because it would be linked to, quality won't show until you actually submit quality information, because it's based on improvement between last year's data submission and this year's data submission. So that might actually come after the fact. But for the complex patient bonus, you should get that right away, because that would be calculated off of your claims and the patients that you have attributed to you as a clinician or as a practice based on how you're reporting.
Does it matter if we're part of an ACO?
That will not show at all then for you.
You would not see it if it, okay. All right.
Correct, because you actually don't get a complex patient bonus if you're part of an ACO.
And small practice as well, right? Because it's all.
So, as part of an accountable care organization or an alternative payment model, you submit quality data through the CMS web interface, which is that pre-selected handful of quality measures. So you're actually not getting evaluated quite the same as the MIPS eligible clinicians. You actually have the opportunity to earn quite a few more points, about 111, I believe, based on the total number of points. Actually, it might be 113 or 130. Sorry, but so you don't get those bonus points because you're not being evaluated for those quality measures and for your performance as a practice individually. You're as that APM entity, so it's evaluated very differently. The only data you would be submitting to CMS as an ACO would be the Promoting Interoperability category, because that's what's required. And just remind me, are you guys at Medicare Savings Track 3?
Track 1.
Track 1. Okay, yeah, so you're definitely submitting Promoting Interoperability data. But that's it. You're not submitting anything else to CMS through the portal.
Okay, great. Thank you.
Absolutely.
Hi, Layla.
Hi.
Hi. Just regarding, as we just brought up the Promoting Interoperability, I have a
Sure.
question in regards to that. We are also a Track 1 ACO as well. And I know typically with some of the practices with different TINs, trying to, kind of go through this process, one thing I have a question is I know as you went through and showing those slides, where does the numerator and the denominator come from? That they do they manually put a number in there?
Yes, so great question. So there's two ways of reporting. So depending on what your EHR system can produce,
Sure.
Sometimes they produce a report for you, which is based on all of your performance throughout whatever your reporting period that you select is. And if you get a report that's in the appropriate format, again, it has to be either XML, JSON, or QRDS3, you would just go ahead and upload that to the portal through that upload link, and it would pull, based on the configuration of that report, because it has to follow those different file types, the portal would just pull all the data right out. It would show you, based on each measure, what your performance was. However, sometimes EHR systems cannot generate that report for you. Either they can't create it for individual clinicians if that's how you're reporting, or as a group if that's how you're reporting. So you need to go in and manually attest. And so all of that data would be the same as what's included in the report. So let's say you look up your e-prescribing measure and you see, okay, my group has had a total of 500 patients that were eligible for this measure in the denominator, and we've done, 250 eligible e-prescriptions, so we're at a 50% performance for this measure. You would just type in 250 in the numerator and 500 in the denominator and move on to the next measure.
Okay, perfect. All right, great. Thank you. That's what I wanted to make sure. I just couldn't remember last year.
Yeah, it can be really kind of funky sometimes, but just make sure if you do end up doing a manual attestation where you're actually keying in the numbers,
Yeah.
I highly recommend having a second or third even pair of eyes. Just glance over everything to make sure you didn't by accident hit 5 or it should have been 6 or whatever the case might be.
Gotcha. Okay, great. Thank you.
Absolutely. I see a couple of questions in the chat. Someone missed some in the beginning. If you have specific questions, I'm happy to answer those. If a practice applied for a small practice exemption in PI, does anything need to be entered in the portal? Oh, that's a great question. I will need to look into that. I'm not sure if it grays it out entirely, but I would believe that if you go back to, where's my screen? Sorry, I'm just trying to get to the right screen. So you'll see right here under PI, it says PI counts for 0% of your score. And then if you go up to quality, it has quality counts for 75% of your score. This would be an organization that had received that promoting interoperability exclusion, thus reweighting it to quality. So you will see something very similar to that, but I don't know if it will limit your access to that actual category. So just be careful not to enter anything, as I mentioned, because as soon as you enter data, you get rid of your exclusion. So any data entry wipes out an exclusion that you might have applied for and been granted. So just be very cautious with that. Let's see, next question is, in the past, our EHR has reported to CMS on our behalf. Has that changed, or and we now need to submit directly to CMS Portal, or will this be sufficient to report our EHR only? So yeah, so your EHR can still report directly to CMS on your behalf. They would need to, the way it would work is you would get a security official role, or someone within your organization would have that security official role to get into the portal, and then the EHR vendor would need to have either staff user or security official, however you want to give them access, but then they would be able to submit data on your behalf. They have to have access to your portal through the HARP, or if they're grandfathered in through the EIDM process, but they would have to have access to your portal to submit the data.
Hey Mila, it's Morgan. While we're waiting for a few more questions to come in, I'd like to just go over the housekeeping items real quick. So thank you again for that great presentation. We are now on social media, so visit us on Facebook, LinkedIn, Twitter, and YouTube. As you close out of the webinar, the evaluation will automatically pop up on your computer. So if you could please fill that out, we would greatly appreciate it. If you don't have time to fill out the evaluation right now, or you're sharing a computer with somebody, you will get an email tomorrow containing a link to the evaluation as well as a link to the event page on our website, where you'll be able to find the presentation and the recording and transcript as soon as they become available. And I'll put that link in chat again, but we'll keep the line open for a few more minutes for some questions.
All right, I see we have a couple more questions in the chat. So do you start with the HARP registration first? Yes, absolutely. You will not be able to get into the portal unless you have a HARP account. So I'll actually bounce back up to that. Sorry, let me get to that first screen. Okay, so you would still go to the same spot that you would go to access the QPP portal if you had an active account, but instead of going to this login, you'd want to click on the register right next door, and that would give you the option to then create your account through the whole HARP process. If, again, you already had an EIDM account active and you could log into the web portal previously, then you would use that same username and password and log in to enter your data or view your data. Next question, would the same apply to registry reporting as above? Yes, you're right. If you were using a registry or an EHR vendor, they would need to have access to your TIN through the portal in order to submit on your behalf. They would either have a security official role if you deem that to be appropriate, or a staff user in order to upload data. And if you go back through, let's see. So on this slide, you'll see the different organization types. So here, registry, submit data on behalf of your clients, view preliminary performance feedback for your clients. They would be the staff user role or the security official. Really, it's all dependent on what makes the most sense for your organization, but they would definitely have to have access to your account in order to submit data. Thank you. Morgan posted information about the presentation, so if you need to get the slides, there's a link there, and we usually have the recording about a week, a little over that, after the presentation. If you missed anything or want to share information with your colleagues or have anyone else attend, we are doing a very similar webinar on Monday, February 4th, and I believe that's 1 to 2 p.m. Is that correct, Morgan?
That is correct.
Great. Here's a link to a few resources as well. There's information on our New England QIN-QIO macro page. You can also ask a question there. There's also a link down here for the CMS Quality Payment Program website. You can get information about your participation status using the participation status lookup tool or the portal. I also wanted to remind everyone that CMS has also updated the information on quality measure specification sheets, as well as the 2019 benchmarks. So if you have any questions or curious about how you might perform in 2019, that information has all been updated on the CMS QPP website. You can go in and identify all those various resources based on the measures or activities you plan to report on. Okay, so question, would you know whether or not there's a section in the HARP system that allows the security official to easily see all users and the security official can easily delete a staff user if appropriate? Yeah, so I apologize, Dan. I didn't put a screenshot of that into the presentation, but there's definitely a way that the security official will be able to see all of the various roles and individuals that have access to that TIN or organization or whatever is appropriate, and they can go in and approve or deny access right there. Let me see if I can actually pull that up really quickly for you. Morgan or WebEx team, is there a way for me to share a separate screen that's not the presentation being displayed right now?
Hey, Leela, it's Morgan. If you go up to the top of your screen, you should see a couple of drop downs. One may say share. If you share your desktop, there you go.
Can you see the Adobe?
I see pending request connected users page in the middle.
Beautiful. Okay. Woohoo! Thank you. Get it right. Okay. So, Anne, this is what the security official would see when they go to manage access, and I can make this document available. It's a CMS document that they put together to manage access, deny, and approve requests for security officials. So here you'll see that manage access. You would see approve, deny, or awaiting approval from the current security official. You would go in, you could see the various users within each of your practices or organizations. And then if you scroll down, you would see all of those connected users. And I believe, and I'll need to check with CMS, but I believe if you click on them, you would have some opportunity to remove them if appropriate. Assuming that they are also not a security official, if they're just a staff user, you could likely just remove them. And I just posted in the chat the link to the HARP account information. If you have any other questions, please feel free to ask them over the phone. It's #6 to unmute your line, or you can ask them in the chat. remain on the line for a little while longer. If anyone has any last questions, feel free to ask them in the chat or over the phone at #6. Or I will go back one slide. If you would like to ask them privately, you're more than welcome to email me directly. All right, well, we're just about at 3 o'clock. Thank you all for joining today, and if you have any additional questions, feel free to reach out to us, and please let us know how things are going. We're definitely interested to hear how the HARP accounts go and if you have any issues. Thanks again. Have a wonderful day.
The leader has disconnected. The conference will be terminated in 5 minutes.